going to get even worse if we do nothing. Let me show you what our problem is and what we're trying to do. We are going to repeal and replace Obamacare, and we're going to do it with a three-pronged approach. Number one is what we're talking about right now. This is what the Ways and Means Committee marked up this morning, what the Commerce Committee is in the middle of right now. That's called reconciliation. That's the American Health Care Act. There are only so many things you can do in that bill because of the Senate floor rules reconciliation. You can't put everything you want in that legislation, because if you did, it would be filibustered and you couldn't even bring it up for a vote in the Senate. Number two, administrative action. This law, Obamacare, has 1,442 sections or instances that gives the Secretary of HHS enormous amounts of discretion to administer health care, meaning I don't think Barack Obama, Nancy Pelosi, and Harry Reid, when they crammed this bill through, ever thought Donald Trump would be president and Tom Price would be the Secretary of HHS. So, number two in our three-pronged approach, administrative action where the Health and Human Services Secretary deregulates the marketplace and allows more choice and more competition to come into the marketplace. Number three, and this is where I think there's a lot of confusion all over the map, additional legislation that we feel is important and necessary to give us a truly competitive healthcare marketplace. So think of things like interstate shopping. That's a reform that we've long believed in, that we think is really important to get regulatory competition, to give people even more choices. Association health plans. Let a farmer buy her insurance through the National Farm Bureau plan, or a restaurateur buy his insurance for he and his employees through the National Restaurant Association plan on a nationwide basis. Let small businesses buy their insurance through the NFIB plan nationwide. We would love for that to be in this reconciliation bill, but the rules in the Senate don't allow that to happen. So we're going to move those bills independently. We're going to move those bills at the same time through our process and bring those to the vote. Unfortunately, they'll have to hit what we call the 60-vote threshold. So we have a three-pronged approach to repealing and replacing Obamacare. Let's get into why this needs to happen and why it needs to happen now. Options are disappearing fast. This law is in the middle of a collapse, and people are quickly losing their choices. In 2016, the amount of counties in America that had three or more insurers, three or more carriers to choose from, was about 2,000. In 2017, that number has plummeted. Insurers are leaving the marketplace, choice and competition is going away, and people are having less choices. How many insurers, how many counties in America that had just one insurer? A little over 200 just last year. So in America, about 200 counties had only one plan to choose from, one insurer. This year, in 2017, that number has skyrocketed to over 1,000 counties. Over 1 in 3 counties in America, you got one plan to choose from. These insurers probably never intended on being monopolists, but they are in these counties. There is no choice, no competition, one plan to choose from. It's a 454% increase in American counties of people who are stuck with one option. Now that Humana has said that they're going to pull out of the marketplace next year, there are going to be counties that will have 0 options. So here is what is happening under a law that is collapsing. Premiums are going up and going up at a very, very fast clip. Options and choices are going down. So what we're seeing in America is people who have to go buy their own health insurance are getting far, far fewer choices, down to the point where they have one in 1 out of 3 counties in America, and the price they pay for that coverage is going up and up and up. Take a look at what's going on around the country. This just shows you a map of the premium increases just this year alone. Minnesota, 59% increase in their health insurance premiums. Pennsylvania, 53% increase in their health insurance premiums. Tennessee, 63% increase in their health insurance premiums this year alone, over 1 year. Alabama, 58%. Oklahoma, 69% increase in their health insurance premiums. Nebraska, 51% increase in their health insurance premiums. Arizona clocked in at a 116% increase in their health insurance premiums with Obamacare. Here's what's happening. Quote, Obamacare is in a death spiral. It is not getting any better, it's getting worse. That's the CEO of one of America's leading health insurance companies, Aetna, said this just a couple weeks ago. What is a death spiral? It's a weird term. It's kind of gruesome if you ask me. A death spiral is a system where in an insurance pool, only sicker people who absolutely have to have the insurance buy it, and healthier people who want the insurance won't pay those really high prices because it's too expensive, and they don't absolutely have to have it because they're healthy. So in any kind of a pool, typically you have a healthy person paying premiums to subsidize that sick person. But the way they just set up Obamacare, it's not working that way. So only the people who must have health insurance, the older and sicker person's buying it, it's cranking up the cost of the insurance so fast that the premiums are just spiraling out of control, and the insurers are losing so much money that they're just pulling out of the marketplace. That's called the death spiral. It is literally an actuarial or mathematical collapse of the insurance markets. That's what America is facing today. If we simply did nothing, just washed our hands of it, if we in the majority party said, you know what, the Democrats gave us Obamacare, let them live with it, the collateral damage in this country would be awful. More and more people would see even higher premiums.